Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm also the inventor of advanced soft tissue release ASTR specialty. I am a cancer survivor and I used to suffer from chronic migraines, headaches, pain and fatigue before I invented ASTR specialty. Right, Shawna, tell me what's going on with your jaw and headache.
So I had a root canal 2 weeks ago and had a bite block in. And when it was in for about an hour when they took the bite block out, it took me a while to get my jaw to close and it was really painful.
So you had muscle spasm after that, okay?
That pain, that soreness in my jaw continued over the next couple of weeks. We thought it was maybe an infection in the tooth still.
Okay.
But this past week, the endodontist I work for and my general dentist both figured out that there isn't any more infection in the tooth. The tooth is doing fine. It's actually, they think, a TMJ issue. The pain is in my jaw, in my ear, radiating out to my temple, my neck, my shoulder.
How much pain from 0 to 10? 10 is the emergency room.
Probably 8 consistently.
8 consistently. Okay.
This week.
For this week, like no relief.
No relief.
Okay.
Right. Before it was, I would say probably at a 6. I was uncomfortable.
After the root canal? Okay.
Yeah.
And do you have any history of TMJ, like pain in your jaw before, or?
No, but I have been grinding my teeth and clenching my jaw for a really long time. I've had a night guard for probably a year or two. Before that I didn't. But every morning I wake up, I'm biting down on that night guard. So.
Oh, okay. So give me a brief history of your headache. What's going on with that? How long is it?
Yeah, I've had headaches for about 10 years.
10 years, okay.
I have them daily. They're almost always on the left side of my head.
Okay.
And sometimes I have a lot of pain right back here on the right side. And it's either like all behind my eye and right here. It could be in my temple. It could be up here above my eyes sometimes.
So you said it's daily for the last 10 years. Okay. And what time of the day you had your worst headache?
I would say in the morning. I probably have my worst headache. So I wake up every morning, usually about 4 or 5, and take headache medicine.
4 in the morning. Oh, wow.
And I'm usually up for 45 minutes or so trying to get the medicine to... Because if I lay down, it hurts worse, and I've actually started sleeping with my head propped up a little more, which has helped a little bit. But I sit up until I can feel that medicine helping a little, but there's no medicine that ever completely
relieve it. Yeah.
Not at all.
So how much the intensity of your headache?
Daily, do you mean?
Daily, yeah. From 0 to 10, 10 is emergency room.
I would say up to an 8. Probably never below a 4 or 5.
So it's a constant, all day long at night.
All day, every day.
So can you tell me what kind of treatments you had for your headache in the last 10 years?
I went to a neurologist, and nothing was found. They told me they were tension headaches.
Okay.
I've had massage therapy, which helped temporarily.
Okay.
I've had chiropractic treatment, which didn't help at all. Acupuncture didn't help at all.
Okay.
I've been on multiple headache medicines prescribed by a doctor that some of them actually made the headache worse.
Okay.
None of them helped, so that was very short-lived.
Oh, so you tried everything in the menu?
I feel like I have. I mean, I don't... Yeah. Essential oils. I mean, every suggestion everyone's ever had, I've tried. Nothing. It doesn't seem like anything touches it. The Excedrin helps temporarily. It takes the edge off.
And you've been taking it for a while, yeah?
I have, yeah.
Wow, okay.
And I've gone through periods of time where I've completely not taken it, and the headaches are still there, and I always kind of end up going back to it because it does something for me.
Okay, just a little bit. Okay. So can you tell me now how much headaches and the symptoms that you're currently experiencing in your head?
What do you mean? Like
for headache symptoms right now? Or how much from 0 to 10 headaches do you feel?
8.
8, and where do you feel it now?
Mostly right here. But again, it's all in my jaw, my ear, my neck, my shoulder.
Okay.
Into my eye.
Into your eye.
And up here too, a little bit. It's just like, feels like it's just radiating all out.
Okay.
So.
Right. So make sure whatever we do is not aggravating your symptoms, okay?
Okay.
All right. Is it okay to mess up your makeup?
Yeah.
Okay, sure. I have to.
First timer next time
ask.
I'll wear a tank top.
Right. Yeah. So sometimes I actually clean the makeup and I forget to ask the patient. I'm like, oh.
And they have to go to work after.
And I have like the patient, you know, usually most of the patient, they know they have their makeup bag when they come here. So this way, they know it's gonna be a mess. Let me know if it's too much, okay? You had any trauma here?
No.
No. Okay. Your fascia is really tight. Make sure this is not painful, okay? So it's around that eye. Is that correct?
Mm-hmm.
Yeah. You feel the tightness in your head?
Yes.
Okay. So this is normal fascial mobility. You feel the movement here?
Uh-huh.
This is not moving at all. Fascia is like a wrap surrounding the entire body. It's like a Spider-Man suit. That's a superficial layer. There's other layers deep. But when you have tightness, it's a very thin layer under the skin. It's like you're wearing a t-shirt 2 to 3 size too tight. So it's compressing everything underneath.
Yes, that's how I feel.
That's, yeah.
Compressed.
Compressed,
Yes.
that's correct. And that's why like medication will not gonna work for that. You know, if the treatment's not geared to release that, it's not gonna be released by doing something else. Does that make sense?
Yes. And that's interesting because sometimes what I'll tell Sean, it's like if I could make some type of contraption that was like a belt I could tighten on my head, I feel like that would feel good, you know? Or I'll have him push on my head really hard or underneath my eyes.
Don't do that at home, okay?
Yeah, no, I'm just talking that that's
yeah.
what I feel like would help is.
So I will tell you a story. Actually, I had a dentist that had a tension headache for 16 years.
Wow.
Okay, we did not get that on the video, unfortunately. But anyway, so she went to the neurologist. She had MRI, like CAT scan, everything. And actually, the neurologist came to tell her, and she was telling him like she feels a band of like pressure and headache in her head. And the neurologist told her, "There is nothing wrong with you. There's something wrong with your head." And she told him, "Yes, that's why I'm here. It's my headache."
Yes.
So,
She said, "I know."
yeah, I know. That's why I'm here. Because everything was negative, so
Yeah.
you're not gonna see the tension headache in the brain scan. You know. So. I discharged her after 2 treatments.
Wow.
Oops, sorry. Sorry, I forgot to say I'm messing up your hair too.
That's okay. It's all fixable.
Okay. So I'm gonna work now on breaking the scar tissue, okay? Make sure it's not painful. You feel those bumps here? That's a scar tissue. So you're probably, because you're clenching a lot, you had a micro tear in your temporalis, and you start to have like a scar tissue. Over the time, the scar tissue is like building up around this area. The problem with scar tissue, our muscle should act like a rubber band. Does this when it contracts. When you have a scar tissue, it's like you have a knot in the rubber band. So when your muscle contracts, it's not a stretch. And that's compressed on the tissue underneath it and could decrease blood flow and could also cause headache. But you feel those bumps? That's around here. You've already here.
Do you want my hair undone or is that fine?
I think that's fine. You can do some work after that. Make sure this is not painful, okay?
It's not.
You feel that more scar tissue in here.
Yeah.
Can you feel that?
Yes.
Typically, if there's no scar tissue, it should feel like this, nice and smooth.
Oh.
Okay?
It doesn't feel like that.
Yeah. So that's, and I'm not surprised from clenching. It's very typical to have those scar tissue. So you've been clenching for how long?
At least 10 years.
10 years, okay. That's when you've been having those headaches. And it's very common with the TMJ that patient develop tension headache from clenching at night. Okay. So you said it's in this spot too? Okay. Is that painful what I'm doing? Is it okay?
That's fine.
How does it feel?
It feels good.
That's good.
It's like the headaches, honestly, it's a little painful right here, but where you're doing it actually feels good.
Okay, so you feel it in your eyes now. Okay. All right. So I want you to line your back head here.
Head here?
Yep. So now the headache only in your eyes, behind your eyes.
Mostly, yeah. Yeah.
Okay. And everything is cleared now?
I think so. Like, it still feels a little sore here, but...
Okay. So make sure this is not painful. Is it too much? You feel it in both eyes or on the left? There you go. You feel the mobility now in your fascia?
Yeah.
That's what should move. Okay. Don't let me move you. Don't let me move you. Don't let me move you. Make sure this is not painful, okay? Did anyone work on you around your nose and your eyes?
No.
Never? Can we get some more of here for me, please? I'm starting with the headache now because you've been having it for 10 years. I want to see how you're doing with that because I hate to see you with the headache for 10 years without relief. So, the tightness here. Is that too much or the? No,
It's fine.
Okay. Yeah. Let's see here. You feel that scar tissue here? Feel that?
Mm-hmm.
Yeah. Okay. Make sure it's not painful, okay? Here we go. Don't let me move your head, okay? Okay, let me work on that while you're here. So you feel it here and going down to your shoulder here. Okay. Oh, you're really tight here. Is that painful here? Here? It's more in here.
Yeah, it's on the left.
Okay.
That's tight too, but this is the really uncomfortable thing.
Is it painful what I'm doing here? Yes, no?
I can't hear you.
Is that painful what I'm doing here?
No.
Okay.
Is it visco or gel?
Sorry.
Right? Yeah. So your right knee. We have it here now.
So most of your pain in that spot is okay to work inside?
Inside, yeah.
Yep.
Do whatever you need to do.
Alright. So, right there. Do not bite me, okay? Open your mouth. close. Thumb up if you feel pain, okay? So you had the root canal here down low.
Yeah,
Okay.
19.
Okay. Okay, let me work on release. Area around here. Thumb up if you feel pain. So this is the worst area, yeah?
Medicare, you have family.
It's too much, okay?
Are you doing therapy now?
That's painful. Yeah, you feel the tightness there? Yeah, that's a lot of fascia tightness here. So I'm trying to release the intraoral fascia. Make sure it's not too much, okay? Too much or it's okay?
I can do it.
No, make sure it's not painful, okay? You feel now the fascia start to loosen up? Okay. And here, that's tight.
No, yeah, not
Make sure this is not too much, okay? Yeah. You feel that band here? That band. Yeah. Don't blame it on me. Yeah. Yeah, they blame their sickness on me because I was sick. Never blame it on the doctor. That's not a good idea.
So March 6th is okay? But
Is that too much? Okay. You feel this band here? Okay. That's from a lot of clenching, actually.
what is your date of birth? Did you already?
We're gonna do more work on it next time.
Your x-rays?
Okay. So start to loosen up.
Good morning.
Good morning.
What is your date of birth?
Okay.
Morning?
You feel that everything starts to loosen up? Okay. Let's set up for me and tell me how you feel. We'll get you some water. Make sure you. Do you feel lightheaded or are you okay?
I'm fine.
Okay.
It's like a release of pressure.
Yeah. That's because the fascia is compressing. Tension headache typically is fascia restriction, scar tissue. Trigger points could be involved with that muscle spasm. So that's why if the therapist or the doctor is not trained to release that, they will never be able to treat it properly because that's the source of the problem. So do you feel headache or it's gone?
I feel this is hurting still right here.
How much from 0 to 10?
Probably like 5.
Okay, so 1 down to 5 and you feel it right here. But behind the eyes and this area,
It's a lot better.
everything's cleared. What about here and here?
This is still hurting right. So I would say here and
Okay.
here.
Or
But everything feels a lot looser.
I'm not sure how much we can get released for this. If you have inflammation, whatever we do is not gonna
Right.
until we get the inflammation down. So let's work on this and try to release that.
The
Okay?
last time you came here in December, right?
Because you had the root canal like 2 weeks ago, so it's still in.
That's like 2.5 weeks. I think.
Yeah, you might have some inflammation there, and that's what you feel. As long as you don't feel the pain here and it's localized there, that's what I care about because
Okay.
I don't expect this totally will be resolved if you have localized inflammation. We're gonna do stuff for inflammation after the video, but you feel it right in here, yeah. Okay,
And right here. too.
right deep in there. Okay, are you wearing contact? Okay. Close your eyes.
You're scaring me
I am.
a little bit.
No, that's okay. Don't do that at home. Okay. Okay. Thumb up if you feel any discomfort. Okay.
¿Cuál es su fecha de nacimiento?
I'm amazed the tightness you get it in those areas. Am I on the right spot of the tightness?
Okay, so I'll go ahead and confirm the appointment today with Dr. Richard Lynn.
You see, with ASTR, we work on the entire body. everywhere, even the eyebrow. So around the eyes. And that's what I give training to doctor, how to use ASTR treatment to treat patient. Okay. Do you still feel it in that spot?
No.
Okay. And here you said around this area?
Mm-hmm.
Okay. We feel like scar tissue here. Like here, this area. Oh.
My temple.
Okay. Let me see if I can do this without lotion. But you feel that scar tissue here? Yeah. Feels like you feel it, yeah?
Yes.
No, the right answer is
Yes.
Okay.
Hello.
Hi.
What's our lotion?
I know. This lotion is the best lotion ever.
So you like our chocolate and our lotion?
Yes, yes.
You should
Everything
move
here is
here.
better.
You should move here.
I feel healthier already.
Alright, awesome.
It is the best though. I bought some too.
Really?
Just hasn't come in yet.
Okay.
Oh, yeah.
It's a moisturizer, it's nothing else. It's just
Let me go ahead
okay.
and
I'm gonna put some lotion here and sorry if I make mess with that, okay? Because I want to get to this area and keep your eyes closed, okay?
yeah, because I'm in the county office, that's why. So I actually wouldn't know. I'm not open. Okay, so let me go ahead and transfer you to everyone else.
Yeah. Sorry. Well, your doctor will know that you had treatment.
Well, I don't have to go to work today, so that's fine.
You don't? Oh, okay, that's good. Okay. With water should be fine, you know, clear up everything. I'm just putting some lotion here so I don't want to irritate your skin. Because you get scar tissue here. You feel all these bumps? Feel that here?
Yes.
And you can see that actually in the camera how it's like not going smoothly, just jumping here. It's, Is that painful here? Yes, no?
It's uncomfortable. It's not painful.
Yeah, okay, so we're not going to do this area. You might have inflammation. Okay, let me clean that. Keep your eyes closed. And don't look in the mirror after this. No, I did not make a big mess. Just sometimes I go home and I found like some lotion on my hair. I'm like, how did this happen?
It just flicked up.
Yeah, so I usually blame it on someone else. Okay, so let's give her some more water. Okay, sit up for me. Let's put it here. Oh,
I
sorry.
looked in the mirror.
Sorry, we have a mirror here. Okay, headache from 0 to 10.
Probably a 2.
Where do you feel it?
Um,
Let me get you more water.
here.
Both sides, deep inside, behind your
Yeah.
eyes.
Yeah. But
That's what you
so
feel?
much better.
Okay, let's drink water and see afterward. Because after I release fascia restrictions and scar tissue that release toxins and waste product, and if we don't flush it out quickly, you might feel soreness from those toxins, not from the headache. Okay, now 0 to 10.
I still feel it behind my eyes and in my like here.
How much?
Probably a 4. I would say 3.
3. The whole, both eyes.
Like here and here. Yeah.
Okay, I am. Okay, close your eyes. Is that too much what I'm doing?
Mm-mm.
Okay. So it's like surrounding your eyes.
Mhm.
Yeah.
Yes.
Okay. Let me know if it's too much. Okay. Okay. Can you feel you breathing better now?
Yeah.
Okay. You know if it's too much, okay?
Okay.
And really do not try this at home.
Oh.
You're gonna cause a flare up, actually. If someone tried this, I had that feedback from people like, try to copy this stuff. If you don't know what you're doing, it just,
Makes it worse.
yes, it makes it really worse. Sorry. Okay. You feel the fascia restrictions?
Mm-hmm.
Yeah. You squint your eyes a lot?
I think so.
Yeah, that's probably you get all of your fascia is really here, especially when you're stressed out. Is that what happened? Okay. So that's what causing those fascia restriction in here. Okay. Feel the tightness?
Okay. Battery. It's gonna die.
Okay. Right, so tell me how you feel now after the treatment. How's the
lot
headache
better.
from 0 to 10?
Probably, I don't really know if I have a headache right now.
All right, awesome. So what do you think about ASTR treatment?
Great.
Yeah, can you tell
Yeah.
a difference than the stuff you had it before?
Yes.
Mm-hmm. Yeah.
I just felt like a total pressure release of my head.
And you had it for 10 years, yeah?
10 years.
Yeah, awesome. Yeah, thank you so much.
Oh, thank you.
Yeah, awesome.
Feel free to subscribe to my channel to get updates about helpful information and tips and tricks on how to relieve your pain and your patient pain. Also, there's over 170 videos, most of them actually real treatment videos. I'm showing how I use ASTR instrument on the patient, and you can actually see the result in the video within the real treatment videos. If you are a healthcare provider, feel free to register for ASTR class so to learn how to actually treat your patient effectively. In ASTR class, I actually utilize over a 400 research study. That's actually what I use as part of the treatment, and that's what I will go over with a health practitioner to learn how to practice effectively based on research study. See you soon.